I'm Dr. Biolsi, the medical director at Middlehope Veterinary Hospital. I'm here today to kind of help describe why we recommend dental cleanings and procedures on your dog and go over the various things that we find on a dental exam, as well as what we find once they're under anesthesia for the dental procedure itself. Here I have Pippa. She's my little model today. She's a very good dog. So when we do a dental exam, we're going to lift their lips and look at their front teeth. And then we try to look as far back here. As we'll show you on the radiographs, I'm still not able to look at every tooth, okay? And even in a good dog, it's very hard to get them sometimes to open their mouth and look back here. You can see there's a large tooth there, which sometimes we may or may not be able to see on a full exam. And so that's one of the reasons we're going to recommend dental exams, especially based on how old they are. Of course, we're going to look for signs of tartar, fractured teeth, evidence of gum recession on this exam, but we can't always see everything on these physicals. And so as pets age, there are things that we're going to want to look for on an exam under anesthesia. So we're going to go over some of these examples of what we routinely find when we have a patient come in for a dental cleaning and dental x-rays. So here we have a 7-year-old dog that has never had a dental before. Overall, you can tell there's some tartar, but it doesn't look that heavy. So one might be thinking that this is a situation where a dental cleaning is not indicated. But again, a dental cleaning is also about doing a complete and full oral exam, as well as getting dental x-rays. In this case, if we now look closely and are able to probe under sedation, we can see that this tooth is actually fractured. And so this fracture was just laying on top because it's still connected to the gum. And then we'll show a picture later that shows you that the root is actually exposed of this tooth. So this tooth actually needs to be extracted. All right, so we removed that slab that fractured off, and so there's two things that we notice here. So this is actually the pulp or the root of the tooth, and you can see that it is exposed, so that when we go to probe goes right into that tooth right there, and you can see it starts to bleed, okay, because that root is exposed. The other thing that slab fractures do is because they go underneath the gum line, you can see that it creates quite a large pocket here. So that's about 5 millimeters. And so even if this pulp wasn't exposed, oftentimes we'll think about extracting the tooth because then tartar and bacteria will actually start accumulating under the gum line because of that. So our first patient here, as you can see, does have a little bit of tartar and staining on her teeth. Some of her teeth are a little worn. Nothing that looks super crazy, but she was almost 5 years old, and we definitely recommend the first dental cleaning for a medium to large size dog, anywhere from 3 to 5 years, and for smaller dogs, usually between 1 to 3 years. In her case, when we look at her, other than the tartar, things looked fairly normal, but after she was under anesthesia and we were able to evaluate things more closely, you can see right here, she actually has 2 roots exposed. So this is where a tooth would have been. And instead of that tooth just being missing, the crown actually fractured off and we have these 2 roots exposed that we can see. When we look at her dental x-rays, we can also see the 2 full roots of these teeth that were present. The crown had fractured off. And actually, this tooth is starting to become unhealthy, so the bone here is starting to look a little bit darker because it is having some lysis. And so this is something that we never would have noticed if we didn't have her in for a dental cleaning with a full exam and dental radiographs. Even though she didn't seem like she was having a problem, this definitely is something that was starting to cause discomfort and would have led to an infection here by the tooth roots. So here's another interesting case, and this is again something that we see in areas where a dog or a cat has missing teeth. So when we have missing teeth, that could be not an issue at all, or sometimes there can actually be a tooth that just never erupted through the jaw and the gum line. What I wanted to show you here is what this tooth looks like normally. So this is a tooth that has come up, and you can see the crown is above the bone, so it's above the jaw. And then I'm going to show you on the other side what happens when it doesn't erupt. So this is the same tooth on the other side. You can see here is the crown. This is the edge of the jaw, so it should actually be through here, and it's not. And then I hope you can appreciate that it looks very dark, or a lot darker than it did on the other side. So our normal bone is kind of down here. This is how bright it should look. And here we're seeing some darker areas, which means that we've lost bone. So this is a particular thing where a cyst will form around a tooth that hasn't come through. And that cyst then actually causes necrosis of the jaw in that area. So the bone actually disintegrates. And so we can see quite a bit of bone loss in these areas over time. So it's very important to evaluate animals with dental x-rays, because you would not be able to see this on physical exam until a lot of bone was already lost. So our dental cleanings, although it is very important to remove the tartar, which traps bacteria, which we'll get into later, it's not just about cleaning the teeth and making the teeth look nicer. A dental is also about doing a full oral exam under anesthesia and getting dental x-rays. And so I hope you can also appreciate how big some of these roots are in our patients. And so this is a lot of area where we can see diseases or issues that we're never going to see on an awake physical exam. We're going to need to do this during a dental procedure that's done under anesthesia. Our next patient does have what we would consider fairly obvious dental disease on a physical exam. So here we're seeing some fairly heavy tartar and calculus that's covering lots of the tooth. We're seeing inflamed gums, and up here we're seeing the gums sort of recede, so I can actually see the roots of the tooth there. So tartar itself is also problematic. So when we see this calculus in these areas, not only does it not look nice, but it's actually trapping bacteria. And as we can see, that tartar is actually starting to extend below the gum line, and that means the bacteria is below the gum line as well. When the bacteria gets below the gum line, it actually starts to eat away at the periodontal ligament and the bone itself around the teeth, which I'm going to show you in these next x-rays. So this is by those lower teeth that we were just looking at that had a lot of tartar on them. You can see that this tooth is barely in the bone anymore. It's actually becoming quite loose. So basically that bacteria caused all of this bone to get eaten away. And as you can see here, it's much lower. So our bone is here, and it should be up here by the crown of the tooth. And so once we have this degree of bone loss, these teeth can no longer be saved and they need to be extracted. So when we start to see, even mild to moderate tartar, it's important to clean it off, to remove that bacteria and that tartar before we get bone loss. Once we get bone loss, we can't reverse it. We can only help halt the process. And so if that bone loss gets to a big enough amount, we have to pull the teeth. I'll show you a few more examples from this dog. So here is an area in its upper jaw, and again, we see almost all the bone is lost around this tooth. This root is barely in anything, and again, it definitely needs to be extracted. Once we extract these teeth, it's also going to help this dog feel a lot more comfortable. We know from people with periodontal disease that when we're getting this bone loss and the bacteria is there, it's actually uncomfortable. Most of our pets will still be eating fine, but we know that it is an uncomfortable process. So not only is it much healthier for them to have these teeth removed with all this bacteria around them, but it also is going to make them a lot more comfortable as well. In this case, we do have another example of a patient that had some obvious signs of dental disease and dental tartar on physical exam. So we can see some very heavy tartar here and a swollen gum, as well as heavy tartar on these lower teeth as well. So when we went ahead and cleaned the teeth, not only did we find some evidence of periodontal disease, but something different as well. So before I show you the x-ray, we can see here, even with the tartar removed, that not only did we have tartar on this tooth and some gum recession, but the tooth itself is getting eaten away in the mouth. And this is something that we call resorptive disease. And so this is exposing the roots of the tooth to the conditions in the mouth, which is very uncomfortable. And if we take a look at the x-rays, we can see how extensive the resorption of these teeth are, so both the crown and the roots of the teeth. And again, we do have some periodontal disease. So this bone is much lower than it should be. So if it was in a healthy animal, the bone would be up here by the crowns of the tooth. But it's already been eroded. And part of that, again, is from the bacteria that's being trapped by the tartar around those teeth. So we're actually going to look at some cats now because they are actually very prone to get that same resorptive disease that we saw in that last dog. In fact, it's much more common in cats than dogs. So we look at this picture, we do see that there is some tartar up here that's starting to accumulate and the gum's receding a little bit. But overall, it looks like the teeth might be fairly healthy. And so when we go in though, clean the teeth and take dental x-rays, again, we find things that we maybe weren't expecting. So at the top of the mouth, so it's oriented a little differently, but this is that large tooth in the top of the mouth. We can kind of see that crown nicely in the bone around it. And if you see here on these other two teeth, we can kind of see the crown. And there's a little hole here, and then the roots are very hard to visualize, and they are resorbing, okay? And especially in these cases where we're starting to see issues with the crown, this can be pretty uncomfortable for the cat, and so it's important to recognize this and address it and extract these teeth. Here's just another example, and this is the lower teeth where visually the crowns had looked fairly normal, but we can really tell that not only is there this big hole in the crown and the back of this one is missing, but the root is resorbing as well. This is just a picture of the healthy two teeth on the other side for you to see how big this crown should have been and what the root should look like. And this has all been resorbed. And so we were able to extract that tooth on the other side as well, and the cat was a lot more comfortable. So this is just another cat that we had in, and this is the before picture. And initially it may look like the teeth look pretty clean, the gums look pretty healthy. One of the things though that we see with resorptive disease, and sometimes we can actually see this on exam, is if we look at this tooth though, we can see that the gum is actually a lot more red here than on the surrounding teeth. And the gum tissue actually seems to be coming up and starting to come over the crown of the tooth a little bit. And this is a classic thing that we can see when that resorptive process is going on. And then this is what we see when we take the dental x-rays. So obviously there's a lot of issues here with the crown of the tooth. So see how it's nice and white here? That's the enamel. It's all been eaten away on this side. And then we're starting to lose the tooth roots here. We can't really see them very well. So we were able to see this on the physical exam, and then the owner brought the patient in to have the dental cleaning done, and we extracted this tooth, and actually the same tooth on the other side had a similar process, and that cat was a lot more comfortable after the procedure. So I hope this video gave you plenty of examples as to why dental care is so important for our pets. That we need full anesthesia to do a full oral exam and to take full mount dental radiographs. And we can find things that are harmful to your pet, that are causing your pet discomfort. And by taking these steps, we can add years to your pet's life.